Okay, we're back, day 2, and I have 3 neonatologists as part of the Resuscitation Focus Group. Dr. Liz Wetzel, Dr. Summer Elshenawy, and Dr. Hannah Hightower, all coming from different places, Riley Children's, CHOA, and Children's of Alabama. Welcome.
Thanks for having us.
Well, we want to focus something specific today. I think it's a super important topic. You guys are doing the workshop on clinical event debriefing in the neonatal intensive care unit. Wow, what a topic to cover. But first, tell me a little bit about the Resuscitation Focus Group. What are some of the missions, the goals, the big tasks, let's say, for this year?
That's a great question. I think one of the things about a resuscitation focus group is we have 3 arms. So we have a QI arm, a research arm, and an education arm.
Okay.
So they're separate groups, and then we all come together under the umbrella of the resuscitation focus group. So our education arm, we're looking for projects recently, but we've done things like surveys in the units to find out what are some of the general demographics, where are the gaps in education, resuscitation. We've looked specifically at simulation. That is a big important thing, something near and dear to my heart. And so looking at, what places are doing it well, what places are struggling, where are the barriers. So that has been some of our focus in the recent past. And I think Summer can speak about one of the other groups for sure.
Yeah, so the clinical research interest group, or the arm of the focus group, has been developing slowly. But we've recognized that there's a paucity of resuscitation literature for neonatal intensive care units, and particularly in the level 4 units. It's such a unique population. So really just like leveraging this amazing collaboration that we have across all of our centers to try to develop a database and really work towards actually collecting good data and granular data for in-hospital resuscitation in the NICU, and using that to sort of start to fuel more scientific literature on that population that we all love.
Awesome. And Hannah, are you in any of the subgroups?
Sure. I can speak a little bit about our QI group that we did some work developing a debrief form to do clinical event debriefing in our level 4 NICUs, and both instituting those into our units and increasing the use of those with code events in our units. And that was very successful, and all of our units have continued to do that even after the QI project ended.
I love that. And correct me if I'm wrong, but the data is pretty clear that even just having a standardized debriefing form impacts, changes, improves those resuscitative events. Is that right?
Correct. It both increases how many of the debriefs you do and get people involved in doing it just by having a form for them to follow, and also then provides you a platform for identifying either improvements that can be made in resuscitation, both in efficacy and identifying any mistakes that may have been made for future improvements and future projects.
I love that. And when we think about neonatal resuscitation, obviously everybody's thinking about the delivery room, but resuscitative events are happening far into a NICU admission. But it sounds like your group is focusing on all types of events. Is that right?
We are. I mean, I definitely think since we're part of the CHNC and the level 4 focus, we're trying to do more there because it seems to be less of the literature out there that's kind of looking at these particular populations, and the populations in the level 4 NICU are different. And so we want to make sure that we don't ignore the things that are happening in the delivery room, but also, what is unique about these level 4 units, and how can we learn from the resuscitations, and how can we develop things that might have a different flavor to it.
I'm going to ask you a question that I didn't prepare you for, and it's a hot topic, I think.
Oh, no. I think I know
what the question's going to be.
So what do we do? Should everybody be NRP and PALS trained as we're caring for these older babies?
Oh, this is a great podcast. Are we about done now? How much time do we have? We have
not to
an
put you
hour?
on the spot, but
That is the hot button.
No, there was a really great recent review, and I think looking at this, I don't think there's a clear answer, and that's, I think that everyone knows that. I think that you can take this approach very differently, thinking about the age of the baby, their postmenstrual age at the time of arrest, thinking about the etiology for the arrest. And I think that there are benefits to NRP and there are benefits to PALS in how you approach your patients. So the answer is, I think we still don't know, but I think the consistency of how you communicate and how your team dynamics works together is going to drive outcomes in your resuscitation. And what we've learned, it's one of the questions on our debrief form is, did you perform NRP or PALS? And what we learned from that is just being able to, just saying NRP versus PALS is not enough. You know, when you have people who are trained in different resuscitation algorithms, it's more important to say, what's my compression to ventilation ratio? When am I going to do a pulse check? And then you may focus on ventilation in the beginning, which really is the hallmark of NRP. But once you get past those initial phases and you've given your doses of epi, you also do need to shift to PALS and think about, what are my H's and T's? What are my, what are reversible causes of this arrest? So I think the answer will be some combination of the two, but also understanding that a resuscitation algorithm needs to be easy and straightforward. And I think really making sure that your team communicates clearly and effectively in whatever algorithm you choose is still the priority in my mind. But
all right, I'm going to throw it out there. I think we need our own resuscitative algorithm for the neonatal decompensation. So I will leave that to your thoughtful group. I don't think NRP or PALS really answers the need that we have. And I think that's why it's been so hard to say, like, what do we use? Because neither of them are right. So maybe that's what you guys can work on.
Yeah,
Okay.
new.
Okay. So let's move on. So you have a workshop. So clinical event debriefing the neonatal intensive care unit. So obviously you will bring into your standardized debriefing form. But tell us a little bit about the goals of the workshop.
I think one thing, we did a workshop last year that about debriefing, and what we learned from going through that experience is some of the things that people really wanted to talk about was psychological safety, or the emotion, the thing that can get bubbling up to the top and get triggered by difficult resuscitations or codes, or even not codes, just chronic patients that might have a decompensation. So what we're using the workshop with this year is to really take a little bit of a turn and focus on some of those psychological safety issues that are so important to make sure that when we're doing a debriefing, we really are getting to the things that Hannah mentioned that can really potentially improve resuscitation. So
Right. How do you navigate that ship with potentially high emotions in a group, a multidisciplinary group?
Yeah, I think you mentioned using a debriefing tool to find room for improvement. And so I wonder, do you guys talk about that specifically? I think that's the hardest piece in moving forward with debriefing. Everybody is worried that things will be punitive or focusing on blame when the goal is really to improve the outcome next time. So what are some ways that we can help protect teams as they navigate that?
I think really focusing on the systems that you have in place versus people. That if there was an error or some part of a protocol that wasn't followed, well, how did the system allow that to happen versus how did a human make a mistake? And really focusing on, and I think having a debrief form, a sort of standardized way to manage that, assist in that, in that it's not just a group of people, sitting around and talking about their experience, but really systematically going through and identifying where did the system maybe fail us? Where did the system allow that error to happen?
Yeah.
And I think going along with that, having a very clear script and using the type of language to set the stage to really encourage the team to avoid blaming language, and then empowering people to pause a debrief when it is starting to feel unproductive, and potentially scheduling it for a different time where you allow emotions to cool and you allow people to kind of take a moment to process, and then bringing in experts for a later debrief that can help manage some of those emotions. And Chavis Patterson is joining us for this workshop, but as a clinical psychologist, figuring out how to support your staff so that, as part of the QI project, it actually was a balancing metric to look at how were the debriefs going and how were people feeling about the debriefs. So allowing that opportunity for people to actually be able to step away if the debrief is becoming too triggering and really come together so that it is a productive discussion that focuses on the systems rather than on the
I
individuals.
love that. And thank you for highlighting again the importance of mental health support in our NICUs, both for families and for staff. So interestingly, the debriefing group last year sent us a number of resources. So we will link those. They highlighted this practice pointer from the BMJ, Team Debriefings in Healthcare, Aligning Intention and Impact. So we can link that. And I think I have this copy of the standardized debriefing form. So if it's okay with you guys, then we can
That'd be
pass
great.
that along
Yeah,
as well.
that's wonderful.
If a team doesn't already have one, then they don't have to reinvent the wheel. All right. Well, thank you all so much for what you're doing, not just educating us, but studying the process so that we can all do better debriefings in our units. Thanks so much.
Wonderful. Thank you.
you.
All right.